David Hill. Awesome.
Very good.
Go on memory.
Very good.
And he is the clinical manager for the Davinci robots, all of the Davinci robots in the panhandle of Florida. So I'm going to let him share with you his knowledge of this awesome robot and take it away.
All right. How are you guys doing? Well, did it go off? How are you guys doing? It's just going in there? Okay, good. Everybody doing good this morning? Yeah, you guys excited about seeing the Davinci? Yeah? So who knows why the surgical system is called the Davinci surgical system? Does anybody know why we named it that? Very good. Pretty close. Getting warm. Getting warm. Well, I wish we had a shot of this, but Leonardo da Vinci actually created the very first robot. And, you can look it up on Wikipedia or on the internet, and it'll have a little picture of the robot that he created. And so that's why we named it the Da Vinci. The name of our company is Intuitive Surgical. And so the reason we called the company Intuitive Surgical is because basically what this system does is it takes the surgeon's natural movements that he or she would be using in a typical open procedure, and it mimics those movements. So just to give you a little overview of surgery in general, there's way back in the past and still today, there's what's called open surgery, where the surgeon makes an incision and he goes in and he extracts certain organs or fixes certain organs, etc. And basically what the surgeon uses is a scalpel, and he opens up the patient and he puts his hands in, and they use sutures and things like that, and they're actually looking right at the anatomy. Well, along about in the late 1980s, a technique called laparoscopic surgery was invented, and basically that's where a surgeon makes little tiny keyholes, and he places long straight instruments in those keyholes, and then he looks up at a monitor. And he takes those instruments, which I don't have any laparoscopic instruments here, but it'd just be a long straight stick, and at the end of the stick would be a little handle, and he would squeeze the handle to make the instrument open and close, and through those holes he would work on the patient. But in that respect, the patient would get a minimally invasive procedure, so they wouldn't get a big long scar. They'd have less recovery, less blood loss. Obviously, they wouldn't have a big scar to worry about as far as being in a bathing suit. So it's cosmesis sensitive, and patients really like that, and so patients demand that. The problem with that technique, though, is there any way I can get the lapel versus holding this? The problem with that technique is it's very hard to learn. So if you think about it, the surgeon's basically has these long instruments that he's having to try to work in a tight, small space with. He's got a camera in the patient, and he's looking up at a 2D monitor, okay? And then, so basically, the surgeon, they had to make some compromises. So they went from, okay, hey, we're going to open the patient up, and we're putting our hands in, and we're fixing the patient, to now, guess what? We're just going to make tiny little holes, and we're going to put these long instruments in, and then we're going to look over here. Somebody's going to put a camera in the patient so I can see what's going on inside, and I'm going to sit here, and I'm going to try to work on the patient without opening them up. So it's a big patient benefit, but it's hard because now I don't have any depth perception. So I'm only looking at a 2D monitor here, so I can't tell how far in or out my instruments are going. So it's very difficult. The second part is if I want the tip of the instrument to move to the right, I've got to move my hand to the left. So I have to think backwards the whole time. Plus, it's at the end of a very long instrument where I'm going to be operating. So if I have any tremor, it's going to magnify that. So I can't be as precise when I'm dissecting or sewing, etc. So basically what they did, the compromise was they had to kind of close one eye. They had to think backwards, okay? And then they lost their depth perception because they can't see with their two eyes 3D. They're having to look at a 2D monitor. So with that, it's a very difficult technique. Well, what this system does is it gives the surgeon back all those compromises. So now the surgeon basically sits at what's called a surgeon console, and he's got a stereo viewer here. So now the surgeon's got his 3D vision back, okay? So they've got depth perception, all right? The second piece of it is now with these are called endowrist instruments. So now instead of just straight kind of chopstick instruments, these have wrists on them. So as the surgeon places his hands in these are called master controllers. As he moves his hands, it translates that movement to the tips of the instrument seamlessly. Plus, what it does is it filters out any tremor he may have, and it gives him more degrees of freedom, more precision and dexterity. And then finally, instead of thinking backwards, moving your hand to the right or moving the instrument tip to the right, you got to move your hand to the left. Again, it's intuitive. So it's intuitive motion. That's where the name of the company came from, Intuitive Surgical. So as far as what the components are called and what they do, again, that's the surgeon console. So that's kind of the surgical cockpit. So the surgeon comes over here, looks in the 3D stereo viewer, places his hands in the master controllers, moves his hands around. You'll see it'll transmit that movement to the tip of the instrument. This is called the vision cart. And so this is where the patient's here, and the actual patient cart would be hooked to the patient, as you probably saw in that video. And then the patient side assist, the nurses will look at this screen. Okay, so they can pass sutures and different things that the surgeon might be using during the surgery. And so another advantage is with the actual patient cart, in addition to the 2 arms here, you've also got a 3rd arm. So now what the surgeon can do is the surgeon can control his own camera. He's got his 2 arms here, plus he's got a 3rd arm if he wants to, grab, retract tissue, and then he can toggle back over and use these 2 arms. So he's got an extra hand to help himself. So it makes the surgeon very autonomous. I'll sit down and I'll kind of show you as I walk through this. You'll see down here at the bottom we've got a foot switch panel as well. On the right side are energy pedals, so that the surgeon can activate energy to like cauterize vessels and bleeding and stuff like that. And then on the left over here, you've got a camera control pedal, and then that's called a master clutch pedal. And what the master clutch does is it disengages the instruments so these can move freely. Because what will happen is as the surgeon's operating, he may kind of get over to this area or get too close or too far apart. And so what he can do is he can press this clutch pedal. It disengages the masters from the instruments, and then he can move back to a more comfortable position. Okay, so you'll see me, I'll play with the operation table a little bit and just kind of show you how it works. But, basically this is the surgical cockpit. So they can come right in here. And you can see I'm moving my hands around, so all the way around. If you can see the tips of the instruments, if you guys can zoom in on that. And then I can actually pull my hands out, and these move 540 degrees. So obviously a lot more than the human hand can do. All right, so what I'll do is I'll come in, and now as my head goes in, there are infrared sensors right here, so that lets me know it's live. So I can go in, you'll hear it beep, give you a happy beep here, and then I'm going to press the camera pedal and hold it, and then move my hands. And see how it moves the endoscope? See that? I can go side to side. It's like bringing a newspaper up to read it. So here we go. I'm going to bring the newspaper up. I'm going to push it away, and then I can let off. I'm going to focus it here. There we go. I can let off, and I can come up here, and I can zoom right in, and I can grab this frog. So with a straight instrument, like I was mentioning before, just conventional laparoscopy, there wouldn't be a wrist right here. It would be straight, so it would be very hard to go in and grab this, and I'd get buzzed right here. I don't think I have it on, but now I can actually articulate my wrist, reach right in, grab that frog out, and then put it right down here. Just like that. Same thing with the gizzard here. You can reach in, grab that gizzard. There you go. Place it here. So let me do this. I'll go ahead and put a 4th arm in here and let you show you how you can toggle over and hold different things. And then we can do some test drives. So typically what happens is, with any surgery or really anything you do, there's always a learning curve. Right. So initially there's a pretty steep learning curve. And what we do on the clinical team is we go in and we train the OR staff on how to set up the robot, how to pull instruments out and then reinsert them, how to manipulate the arms and get them set up, and all that good stuff. So there's a learning curve there, but then they get very proficient, and so they get their times back down to what they were before. And that typically takes, somewhere around 20 procedures, something like that. For a surgeon, same thing. What we do is we'll start them out and we'll have, have them do some what we call level 1 procedures that are very simple, just so they can get used to all the bells and whistles and using the system. And initially, it'll be longer, but then after about 20, 25 cases, their case times will actually decrease because they're not over the patient struggling and trying to get angles. And then what happens is instead of this endoscope being mounted and static and controllable by the surgeon, you've got basically, you've got a patient side assist sitting there holding this next to the patient. And so the surgeon's sitting right next to her, and he's going, okay, all right, move it over a little bit. And she moves it over, and then she starts to drift. Move it back over, she starts to drift. You know what I mean? So it's a lot easier on the patient side assist as well. So yeah, eventually the times do go down, but it takes 20, 25 cases. The real benefit is that now surgeons are able to tackle cases that are really complex. So before, where they were limited with sticks and trying to get dissection planes, and they had straight wrists and they couldn't get around to dissect where they needed to. Now with the Davinci, they've got 10 times magnification. They've got tremor filtration. The movements are also scaled. So as you move your hands in the master controller, it's set to a 3-1 for default. But as the surgeon moves his hand 3 units in space there, it only moves 1 unit in space here. So, and you can get that up to 5-1, for instance, if you're doing like a cardiac procedure or something like that. So it allows them to be more dexterous, more precise, better visualization. So they can go in there and they can dissect out, scar tissue and what we call adhesions and things like that, cancer cases for pulling out lymph nodes and things like that, much more precisely. And what that means for the patient is that there's less trauma. So that patient, the next day, they're up and they're asking to go home, So.
Does it also help with like the fatigue of the surgeons that they don't get as tired because?
Absolutely. There's a big ergonomic benefit. Obviously now they're seated at a console comfortably. They're not over a patient for hours on end. You hear a lot of surgeons talk about just orthopedic issues that they're starting to have, and so it can be a career extender, absolutely. So that's definitely a value proposition for the surgeon. What do you guys think? Pretty cool. You want to give it a test drive? Yes. All right. We've got a lot of folks. So yeah, go ahead. Do you have a question? Or you want to go first? Is that it? All right, come on over. All right. So have a seat here. Now what's cool about this system is basically he can affect the ergonomics, adjust the ergonomics to fit his body, and it'll save that for the next time he sits down. So, all right, what you want to do is just place your forearms right here, and you're going to take your middle finger and your thumb. You're going to place it right in the calipers, just like that. Or you can do your index finger, whichever feels better for you. There you go. Okay, so scoot up a little bit. There you go. Now let's drop this down so it's a little more comfortable. All right, then we're going to drop this down, and you're going to place your forehead right here. See this little pad right here? All right. All right, can you see pretty good? Okay. Are your eyes adjusted? Okay. Now what you're going to do is you're going to do what's called follow-on match grip, and so he's going to pinch his fingers, and you'll actually see right up here. So go ahead and pinch. Pinch and start moving. All right, move your left hand. Other left. So just pinch and release your left hand. And you can see, all right, so just do it really easy. Now don't turn it as you pinch, just pinch and release. There you go. And you can see up here. And so what's cool about this is this is a touch screen, so I can actually telestrate on here, and he can see that in the console. And then you can erase it here, which is really nice. So during a surgery, say we've got a proctor in, there's a new surgeon on the console, he can go, hey, why don't you go ahead and dissect, like right in this area, or here's a belly button. There you go. Go ahead and take out the belly button, and he'll be able to see that. All right, so now let's do this. You're going to grab the toilet bowl? Okay. Now, what this shows you up here, it shows you that here's arm 2. So you can see arm 2. And these are photorealistic icons. So it's basically a little picture of whatever you're trying to figure out, what's what. So here's number 2. There's a hand next to it. Tells him he's got a large needle driver. And then here's 1, and then here's arm 3 over here. And so there's the third arm. We can get this, put this in the operative field down here. There we go. Okay, good. There are a couple of different views. Let me show you the view that he's seeing. So this is an endoscope view. This is a nice wide view for the patient side assistant. I'm probably in your way. Sorry about that. Basically, they want to see the periphery. So when they're inserting these instruments and taking them out, they want to be able to see where they're going. But what he's actually seeing inside the console, and I can press this button, that's his view right there. It's a little more narrow of a view. And he can see his foot switch panel down here. It tells him what instruments he's using. Here's a picture of its endoscope, okay? So it's kind of like his surgical cockpit. It's all his different parameters there. And then he's seeing a 3D view. So he actually has depth perception. So he can reach, he knows how far in and out he's reaching, and that's why he can be so precise. And it's on the right eye, okay? Now I can switch over to the left eye. Whereas, if you guys remember, I was telling you about the conventional laparoscopy where the surgeon stands over the patient with the sticks. That's just a 2D scope. There's only one lens. On this scope, we'll look at it in a minute. We can take it out and I'll show it to you. But it's got 2 eyes. It's 2 eyes, and so that's why he's got the 3D stereoscopic vision. Now, why don't you do this? What was your name? Micah. All right, do this. All right, see this pedal down here? It's got a little picture of a camera. All right, when you press and hold that pedal, and then you move your master controllers, it's going to move the camera for you. Yep. So it's like reading the newspaper. So to pull in or push out, you can go left, right, wherever you want to go. So let's do this. Yep, good. All right, so let go of the pedal, and then move your instruments over here together. Yep. Now hit the pedal. Press and hold the pedal, and bring your hands towards you. There you go, because you can zoom right down in on that. Good. Let's go over here to the frog. So take both your instruments over to the frog up there. There you go. Yep, see how he's starting to move around already? So now he can move around the entire terrain, the entire surgical field, and zoom into it. Good. Why don't you go ahead and put the frog back in? See if this thing's on. Yeah, let's do that. Good idea. Yeah, make it tough for him. That's good idea. Good, yeah. Move all the way back down. So see, he's already starting to learn. So basically, you want to keep your instruments together, bring them back, and you're just basically, it's like you're pulling the portrait around. Okay? All right, Micah, do this for me. See if you can grab that penny and pick it up. Yep, so zoom over there to it. Good. Try to grab it right on the edge. Good. Okay. Now do this. Bring that penny to where it fills up your entire screen. Bring it all the way up to, keep coming, until the glare is off. Keep bringing it in. Is that as far? Okay. So now, do this for me. See how your hand is all the way up against the armrest here? Press the pedal above it, right here. No, one up above. Press that. Push your hands away. Let go. All right, now bring it in. Keep coming. Okay, good. All right, stop right there. Now, I want you to press the camera pedal, and then with just one hand, pretend you're starting a car. Twist it like you're starting an ignition on a car, and that's going to be your focus. So push it back the other way, and then let off the pedal when you get focused. All right, stop. Good. All right, you guys see Lincoln right here in the Lincoln Memorial? You ever seen that before? Yeah, it's pretty cool, huh? So that just demonstrates the visualization, the 10 times magnification. So you can imagine you could see nerves and vessels and all that so much better